Today we are talking about this study, which is really groundbreaking, and it's also really demonstrating the UAE in terms of its progressive nature towards mental health and employee engagement. So the plan for today is I'm going to be introducing Leah Cottrell, the CEO, shortly. But then after Leah, we will then have a panel discussion where we'll really break down into the study. If we have time, there'll be opportunity for questions. But if not, because we have to finish at 10 o'clock, because we can get you back on the roads, back to your meetings, so we don't add stress to your day, there will be an opportunity to approach the panel if we don't manage to make the Q&A. So if you can forgive me for if we do overrun on the panel, if there's too much to cover. But otherwise, thank you to our venue, the Hilton. It's a lovely, what a nice view. A nice reminder of why we're all in Dubai. So without further ado, it's my great honour to now introduce Leah Cottrell, the CEO of Cigna Healthcare.
So, good morning, everyone. It's fabulous to see so many familiar faces, as well as lots of new ones as well, interested in our health study. And I'd like to thank all of my Cigna Healthcare colleagues here, as well as around the world, and Dubai Chamber, or British Chamber of Commerce Dubai, for continued partnership. And we're excited to be here for the second year in a row, with our launch of the study. We love this time of year because these insights give us lots and lots of new talking points, lots of things to bring to all of you and our clients and, frankly, the community around vitality and well-being. And obviously, we're just about to go into Dubai Fitness Challenge. Everyone got their plans for the 1st of November. And we really hope that, this narrative really helps open the conversation within organizations, but also within families and communities about how we understand each other and also how we can proactively manage all of the multiple dimensions of healthcare. And I think that's been one of the really interesting things over the years is when we think about well-being, we don't just think about physical well-being anymore. We think in a much broader set of dimensions. As you probably know from the various different engagements, Cigna Healthcare is a huge advocate for improving health. And we've been conducting this annual insight study that helps us really understand the key insights and aspects of health and well-being. And all of that is not just to stand up and promote ourselves, but actually to help improve the vitality of the people we serve and the communities that we operate in. The Cigna International Health Study is actually in its 10th year, so we've got lots and lots of data, but we have continued to evolve it with the times. This year, in 2025, the survey spans 13 markets, and we interviewed over 11,000 people, of which there are about 1,000 here in the UAE. So we've got a decent sample. And what I'm going to present today is the representation of those 1,000 people, but just to be clear, they're not necessarily Cigna customers, right? This was a survey that was done with the general population. I think that's important as we sort of think about interpreting the insights, particularly, I think, for the panel, Katie. The study includes something called the Evernorth Vitality Index. Some of you may remember it from the last couple of years. This was designed in partnership with a gentleman called Dr. Richard Ryan, who is a renowned psychologist. And the Vitality Index gives a full picture of health and well-being across 8 interdependent dimensions that you will see on the slide over here. If you think about the fact that it effectively accounts for how we feel, and it presents this as a single index representative, if you like, of a whole person health. And it's important because health and vitality are foundational for thriving individuals, families, communities, and they really help foster a productive and healthy economy, workforce, and society. So those of you that joined last year, you know that there's a whole bunch of stats coming, right? So buckle up. But first, we are going to try something new. What we'd like to do is conduct a quick assessment of the vitality and the well-being of you guys here in the room. Okay, no pressure. It's anonymous, don't worry. So here's the plan. We're going to run 10 questions on Slido. So please grab your phones, get the QR code up, and we'll go through the 10 questions. This is a small proportion of the questions that we asked the broader respondent base. So by the end of today, we will know what the vitality is of the folks in the room. So here we go. The scale is 1 to 7. It's the same in every single one of them. Read the statement at the top. If you absolutely do not agree, that is a 1. If you totally agree, that's a 7. So first question is, I really value learning new things and understanding more and more. Okay, next one. I know places I can always go in which I feel safe and well. Okay, it looks like we're there, 46 respondents. Next one. I choose to prioritize my physical health. 1, I don't agree. 7, I totally agree. I've got a feeling this vitality score is going to be pretty good, guys. Please be honest, though. Okay, next one. I can successfully build connections with others. I think the fact that you've all chosen to schlep through traffic and come down here this morning is probably a pretty good indication of this score. Okay? I feel capable of managing my emotions. 1, absolutely not. 7, yeah, I got it. Okay, that's my 48 responses. Okay, I look forward to each new day. Okay, I have all of the skills and tools necessary to live a healthy life. Straight in there with some 7s, huh? I'm impressed. If I could just get 40 hours in a day, I would have the skills and tools necessary to live a healthy life. Okay, brilliant. I feel alive and vital. Interpret as you wish. I have the freedoms and opportunities to financially support myself. And I feel energized. The team are going to busily crunch some numbers based on your responses. And at some point, are going to come and give me a little post-it note so I can share your vitality score as a group. So let's get into the data. So this is the vitality score. Okay, so this is the Evernorth vitality score. And as you can see for this year, the UAE has scored 73.3, which is just ever so slightly up on last year. Okay, so this is a really high score relative to the other 13 countries, and as you can see, is also a high benchmark against the globe. I think what's interesting is that we are gradually edging that vitality score up, whereas sadly, the globe in general is notching downwards. And as I mentioned before, this is the score that measures all of those 8 different dimensions of health. And it's important because the higher people's vitality, typically, the more able they are to deal with what life throws at you. Typically higher resilience, typically higher stress coping mechanisms, that sort of thing. And so in societies or in groups or in workplaces where we have lower vitality, we need to make sure that we are sensitive to how we support people and how, I think we all know that everyone responds differently to different situations. The vitality measure can actually be a good indicator of how a population could respond to an incident. We also measured in the survey a well-being index. And the 2025 study revealed that the UAE has an overall higher well-being index at 70 for 2025, which is up an incredible 8 points. And that's compared to a global index of 41. I'm conscious that there's a whole ton of data on the slide, so let me really, really quickly try and navigate it for you. So to the left are the well-being pillars, right? So as we said, it's multidimensional. You've got the overall well-being score, but then family, mental, social, spiritual, physical, workplace, and financial. The orange data points are a global view. So this is an aggregate view of the 13 markets that we surveyed, and the UAE to the green, in the green is to the right. So the score shown is for 2025, and then the arrow next to it is indicating a comparison over 2024. So, without needing to be a very numbers people, you can see that our country scores have increased with a positive trajectory across all 7 of those well-being facets, whereas on the contrary, the global scores have dipped, but they've also dipped pretty consistently across all of the well-being pillars. So actually, the UAE and Saudi fare better in the overall well-being than many of the global economies. We conducted this same survey in Saudi as well, just to try and sort of build on that regional perspective. So we here are performing better in a sense than the UK, the US, Hong Kong, which indicates a more resilient state of mind here in the Middle East. One of the important positive trends is the fact that the country's physical well-being continues to outperform global averages. And physical well-being actually surged to 69%. And I can't help but think that this is pretty indicative of the really positive work that's done by the leadership of the country, building infrastructure and engaging residents and citizens to take on regular exercises and sports. I know our team are already signing up for making plans to jump the corporate leaderboard with Dubai Fitness Challenge in the coming months. So here's a bit of an interesting paradigm though. Despite trending highest worldwide for physical well-being, we've also seen that unlike folks in other parts of the world, the UAE ranks mental health as the #1 priority for them. So when the respondents are asked what's the most important dimension for them, 27% said mental well-being. And that's above physical well-being here in the UAE. And I think we've got to reflect on that and say that's a pretty big cultural shift. And I'm sure it's also thanks to programs that have made mental health more visible, more accessible, like the national initiatives, the federal mental health law, Dubai's mental health framework. And I think we probably all agree that COVID played its role in sort of changing perceptions of priorities from a health standpoint. And I think these initiatives have also made a really good impact on the mental well-being scores as well. So after recording a huge drop from 23 into 24, we've really started to rebound in 25 with a score of 64. So we're still a way off 2023, but I think, again, there's a positive inertia as a result of the great work that's been done, in fact, by many people in the room here today. And I don't know about you, but when I think about mental health, I think stress comes to our minds, right, as one of the issues. The region, and actually in particular the UAE, have always recorded high stress levels. And that has remained relatively unchanged in 2025, with 84% reporting that they feel stressed. And that's up just from 82% in 2024. An interesting shift, though, is that what's driving that stress now is around family finances. And that's overtaken personal finances as being the top stressor. We've also observed that women report more stress about family finance. And perhaps that's not surprising given our sort of traditional societal roles in looking after the family. A worrying stat, though, for me, is the high stress levels that young adults face, and I think this has been reported quite widely. So those in the 18 to 24 age group, or 89% are reporting to feel stressed, and perhaps more concerningly is that 21% define that stress as being unmanageable. Now that is down ever so slightly from last year. It was 23% last year, so maybe there is a slight improvement of that trajectory. But I think we could probably all argue that stress can be positive. Certain degrees of stress can be positive and motivational, and perhaps is a reflection of this fast-paced society that we live in. But I don't think there's anything positive about unmanageable stress, and that's where people need support. So for those of you that joined us last year, you may remember that family started to become a real feature. This interesting correlation for me between the family finances and the importance of family. So family sort of has become the UAE's superpower, if you like, with 71% of respondents rating family well-being as the highest dimension of well-being. And that's nearly 20% over the global average. And perhaps that's why you connect it back to the family finances, right? Family is such an important part of people's ecosystem. And similarly, such is the importance of family, it also means that for people living away from family, which, let's face it, most of us are, we're seeing loneliness continue to be a feature, with 43% of respondents identifying as feeling lonely, and 47% saying that they lack companionship. And this is exacerbated even more in the younger adults, in the sort of Gen Z population that report the highest levels of loneliness. And I think one of the things that we've talked about in the past is, is this a bit of a function of the digital age? But what it definitely does is indicate that this population seek greater companionship and meaningful connections. For me as an employer, never mind a parent, mine aren't quite there yet, but me as an employer, we really need to think about what support we offer for these folks in the workplace, where that sort of purpose and belonging is incredibly important. And I guess on that topic, and one of my favorite topics is workplace well-being, it's great to see that the well-being score has progressed a little, and we're now at 51%. Incredible sort of paradox, though, is that whilst 51% are feeling positive about the workplaces that they operate in, 67% are still saying that they are likely to look for a new job. And that's almost double the global average. And there's part of me that says, nah, of course they're saying, It's the same in the HR surveys, right? Everyone says that they don't get paid enough. Of course, everyone says that they're looking for a new job. But take note, because last year we were able to show that of those people that said they were likely to look for a new job, 50% actually did it. So, on the other hand, perhaps it's not surprising. We are in a fast-moving market. People are ambitious, and there's opportunities everywhere. So typically, job mobility is high. We have also noticed a gender disparity, where female employees report a higher workplace stress as compared to their male counterparts. And when I looked at the numbers compared to 2024, this worried me a bit more, because the men's score is down 4 or 5 points, whereas the women's score is up 10. So there is a definite trend towards women not feeling supported in the workplace. Women are worried about family finances. And as we'll go on to see, there's definitely an opportunity to, from a management perspective, to see how we can support people in the workplace better. And that's exactly it, right? Support from line managers continues to be a gap in employee experience. What's the saying? People don't leave companies, they leave managers, right? Employees seek support from their employers or their line managers that many feel that they're not getting today. So only about half of those surveyed reported to feel understood by their immediate supervisor. And for women, that dropped lower and even lower compared to 2024. Interestingly, it seems that globally, managers are maybe a little bit more understanding. But here in the UAE, we're seeing that downward trend in both a feeling of being understood, that's that 50%, as well as a feeling that you're supported for personal commitments. And only 39% of men and 32% of women feel appropriately recognized by their manager, which to me is jumping out as, there's lots of opportunities for improvement. And I don't know how you're reflecting on these data points as you're sat here in the room, but this stuff doesn't need to cost a lot of money, right? This is not big investments in programs. This is about making sure that we have a line management layer that can support people. It's about empathetic leadership. So I think there's a big piece that I'm quite looking forward to sort of bringing out here. And staying in the workplace, totally biased, confession. I'm delighted to see that healthcare has officially taken up the top spot as the most wanted employee benefit in the UAE. So we've now got 35% of UAE employees rating healthcare as the most important benefit. And I guess, again, the stats reaffirm that it's easy to see why. 37% of the people who responded said that physical health is impacting their work. So they're likely less productive, right? Possibly some presenteeism going on there. And 31% say the same about their mental health. What's especially worrying is that 36% of respondents avoid care due to waiting times. And, not only is this obviously negative for individuals' health outcomes, but 50% are saying that these delays also negatively impact their work. So we're seeing this building view of factors almost outside of the workplace, if you like, really impacting productivity and the workplace ecosystem. So quality healthcare benefits are not just a nice to have anymore. It's the benefits that employees value above all, and across all age profiles. I hear a lot of, oh, my team are younger, they don't need to have good healthcare. You know, hey, guess what? This stuff happens to us all, regardless of how old we are. And a final topic before I wrap up. For the first time, we have asked the respondents about AI in healthcare and what's their perception of AI in healthcare. And it turns out that the UAE is actually the most optimistic of the 13 markets that we surveyed, with 61% feeling positive about it. So what are they hoping for? Well, they're hoping for shorter wait times, more accurate diagnoses, and better support from doctors. And it's probably no surprise that these younger folks are leading the charge in that enthusiasm for digital health, whilst the older generations are a little more cautiously optimistic. And I think that this sentiment from the UAE respondents really aligns well with the UAE's national AI and digital health strategy that aims to build this future-ready ecosystem. I mean, if I were to look around the room, who's wearing wearables today? Yeah, the stats are sort of 40%-ish of the UAE population are using tech to, you know, engage themselves and raise awareness and drive accountability for their own health. I do also know a few people that have started running comparisons with their various different wearables. So I don't think anyone's suggesting that we take them explicitly, but it's there as a tool, right? So in closing, there's a few key takeaways, and everyone has got a copy of the detailed report on their table. But UAE's superpower is family, with 71% ranking it the highest well-being attribute. Financial well-being is the lowest well-being attribute at 35%, so there's definitely some opportunity there, and I know we're about to explore that on the panel just now. Male respondents in the workplace are generally reporting results more positively than women by around 5 points. Mental health, with an overall well-being ranking of 64%, is now deemed to be the biggest personal priority of the majority of individuals here in the UAE. Meanwhile, stress has risen to 84%, reaffirming that, look, we still need to keep a track of this, right? In previous years, we've talked about the always-on culture. I think that's the good and the bad of Dubai, right? But we need to be able to manage it. And those unmanageable numbers are what really sticks in my head. And finally, 52% of men and 48% of women feel that they work environments that support family and personal commitments, which is fabulous for those 52% and 48% of women. But what about the other 48% and 52% who don't feel like they have that necessary support, and what impact does that have on them, the organizations they work for, and their productivity? So I will pause with the influx of data there and ask Katie to join us at the panel.
Okay, so there was, I'm trying not to put too many kind of personal views on, because obviously there's lots of things that everybody will take out different areas. We've got lots of experts in the room that will take on a lot of those data points for their own expertise. I'll come to you first, Leah, because one area that I thought was really interesting, and it is a little bit a kind of chicken and egg in a way, where the UAE is really showing its outstanding efforts and commitment to mental well-being. And you mentioned the 30-30. We have a national, Minister of Happiness. I don't think that's anywhere else in the world. We also have mental awards for 3 years in the running, really celebrating mental health and well-being initiatives in industry. So is there perhaps, with the UAE's vision, there's more awareness, so people are more likely to identify themselves as stressed? What would you say about that? Does that kind of affect the report in a way?
I mean, as I mentioned earlier on, it was 17 and a half years ago that I arrived here, and I think it's incredible that we are now able to sit and talk about this in the way that we are. So I think on one hand, great. We probably should have been doing it for longer. I think that ecosystem's got a lot to play in it, right? If people are standing up, if the government is giving mental health focus and airtime, and we can talk about mental health, we can talk about happiness, we can talk about stress. We know that they are all the various different sort of intertwined dimensions, if you like, of this word that we've chosen to use as vitality, right? But so I think, yes, absolutely. I think the more people that are speaking about it, the more people will feel willing and able to speak up. One of the things that we've talked about at Cigna is encouraging people to be okay saying, I'm not okay. And I think that's where I feel that we're really starting to make good, positive moves.
Definitely, thank you. And Ezra, I'm going to come to you now. I'll give a quick anecdote. This was me yesterday morning as a working mum, and my daughter was not right mentally. She was really anxious, and she asked to have a day at home. And it was effectively a working from home day because she was catching up on study. I knew from just looking at her she wasn't going to do well in school with all of the cacophony of noise and everything. In your work with children and families, what are those links between mental and physical health?
What you've described is very typical of what we are seeing as clinicians, as a parent myself. So we see that young people, children, not just teens, are under an incredible amount of pressure from academics. They are incredibly overscheduled, I would say. And of course, there's screen time, technology. Families are torn between work-life balance. So there's so many factors there that we're seeing that are impacting on children's well-being. So absolutely what you describe is not uncommon at all.
It was like kind of baby burnout almost. So thank you for that. And we'll come back in more detail around the great work that you're doing as well. Sandeep, I'm coming to you. So King's College Hospital London, another annual strategic partner of the British Chamber, showing our commitment to healthcare and wellbeing. Great to work with you. One of our panels we had recently was around AI in healthcare. We had the NHS representing as well. And something you talked about that I thought was so poignant, and I've remembered even 80 events that we have, it really stuck out, was the great work that King's is doing, embedding AI into healthcare. Could you give us some insights into those that aren't already patients?
I speak with a lot of bias because I'm an innovation officer, so I'm obviously going to support innovation in healthcare, but I've been doing innovation in healthcare now for over 10 years at a macro level, at a national system in Australia, and obviously now at a provider level here in the UAE. And I've had the pleasure of leading now coming up to 100 implementations of AI in different fields, whether it be in risk stratification or in wearables. So I feel like I'm speaking with confidence that I have a fair amount of facts and also a fair amount of failings as well, right? Because technology is no silver bullet. So I could talk to you about the many lessons about wearables, but I'll jump to the King's agenda. I mean, in King's we have 4 very clear focus areas about how technology can transform health systems. Obviously, the first is about the patient and what we can do, and I'll come back to that because it's probably the most relevant to this room. But the second is about how do we support our staff, and I'll talk a little bit about that as well. And then foundationally, I mean, health systems are some of the most complicated systems that you can work in, because what you see as a physician, not all the 1,000 other services that have to work for a health system to work, whether it be procurement, HR, blah. There's a lot behind the scenes. And then the final thing's about liberation. It's about how we liberate the total experience for health systems. And we think about innovation in a braided way. We think about when we innovate, we don't only apply technology for the sake of it, we also think about the human factor and the human in the loop. And so if I jump to King's, I'll just give you some examples. The first one is the adoption of AI in diagnostics. So you'll see we're quite vocal about the use of AI in mammography, in breast screening. Why are we applying AI in breast screening? I'll tell you one thing. The thing I've learned about humans and driving transformation in multiple systems is that we are consistently inconsistent. That's what we are. And a radiologist may read up to 100 images a day, whether it be X-rays mixed with CTs and MRIs and then a mammogram. And most of our radiologists work in hybrid modalities. We have certain radiologists that are breast screening specialists, but they also have to do work in other modalities. And the reality is that in the medical world, there is a breadth of fatigue. That's why you see growing waiting lists. And so it's very easy for a radiologist globally, this is not just a UAE thing, and it could be a radiologist that's trained for 30 years to miss that one diagnosis. And that one diagnosis may be you. And so why we've applied AI in breast screening is because it's consistently consistent. It is the second read to every read that we do to make sure that if there is something that the radiologist may have missed, the AI is there just to support them to say, but there is a potential finding here. What we've also learnt about AI in screening is that it performs better than without a physician having AI. So it does not perform better than a physician. That's wrong. But a physician with AI or without AI performs better in diagnostic specialties. And I heard this amazing story of a woman who was 34 who had her traditional screening. And by the way, you can all do this because you can jump on Annalise AI or Lunit, grab your images. You can do this, by the way, and upload your images. Obviously, it's your consent, and get the AI to read. And I won't tell you the story, and it's not a king story, which I'm proud of. But this woman uploaded her own images and found a positive finding. Went to a different hospital, and that positive finding through a biopsy was validated. And she detected breast cancer at stage 1. So there's many facts. There's a lot of research about this. The second thing is this human connection. Again, I'll be conscious that I want to pass the microphone to my colleagues here on the panel. We've applied AI in the conversation with the consultant. So if you come to King's, you'll probably see a microphone on the table, and you'll be asked to give consent, of course. And what that technology is doing is not only transcribing the conversation, but it's transforming the conversation. So what we've learned in health systems globally is that physicians who are fatigued are ultimately poor at documentation. Now, I'm not criticizing any of my potential doctors in the room, but we're astronomically poor at documentation because we capture what we think is relevant for us in providing care to you, not what you think is relevant for you as a patient. And so what that technology has allowed us to do is capture a breadth of information that we traditionally wouldn't capture, but also completely transformed what you're spending your pivotal time on with a physician, which is that physician focusing on you and not focusing on the computer. I mean, I don't know, hands up, just hands up in the crowd. When's the last time you went and seen one of your doctors and all they did was look at you for 5 minutes and then look at the computer for 10? Let's be real, right? Come on. So at King's, we are transforming this concept because when you're with us for that 15 minutes or that 30 minutes, depending on the specialist you're seeing, we want to make sure that we're focusing on you and that technology is working in the background to not only document but transform that conversation. And I'll tell you that this is not about efficiency. What we've actually learnt is the depth of information that we're capturing now, because we're capturing information that we traditionally wouldn't capture. I'm sure my colleagues here in Cigna will appreciate this over time, is that we can now run algorithms that we previously never could on your unstructured data, because we wouldn't usually capture that. And it could be something as simple as you just said you've had poor sleep. We wouldn't document that because you're seeing us for an influenza case. I'm just giving it baseline. We think that's irrelevant to this presentation. Because the technology is now capturing that, and we can now see that it's consistently capturing these factors, we might realise that in the last 4 times that you've come and seen us at King's, you've had sleep issues. And that one factor could be a predictor to an underlying cause that we never would have diagnosed until it was too late. So again, I could keep unpacking this. There's so much we're doing. I'm very proud that we've already delivered over 10 of the national leading innovations in AI application in healthcare. But this is just some of the things that we're doing to transform, health provision and healthcare globally.
Fantastic, thank you. Really pioneering there. And it definitely shows in the study that there's a trust in the AI as well, and there's an expectation for the AI to be used. Coming to you, Danielle, so financial being one of the top stressors in the study, that must go hand in hand with the rising cost of living, potentially the rise of divorce cases in the region as well. What are you seeing, speaking to your clients, around how best to prepare to avoid this financial stress?
Yeah, so you're absolutely right, and for me, in the financial wellbeing sector, it's hugely concerning and definitely something I'm hugely passionate about. I've always said that happiness, health, and wealth is a byproduct, and obviously a triangle that leads to each other. And when we talk about wealth, we talk about financial wellbeing. It's the state of being that an individual feels stable, comfortable, and secure within their own financial circumstances, and that stems across their family. What we are seeing within the Cigna study, but also across a lot of my clients, is this term that we deem the sandwich generation currently, which, whether you have children of your own, we're in an environment now where we have longevity at play, again, stemming into health, the development of technology and healthcare. But what that is doing financially is putting a lot of pressure on individuals within their own family dynamics, because we do now have this shifting dynamic from pressure for children and concern that we have about their own well-being financially, but also throughout the stages, but also with regards to longevity and aging parents, the financial stability for them when it comes to long-term care. And again, I think employers need to definitely be on board and accommodate and acknowledge the kind of variations across that as well. Again, we are seeing a rise in divorce cases, and again, a lot of that puts a lot of financial pressure across the globe. We've heard a lot of stories where divorce has been deferred, or couples are cohabiting longer than they should be or could be, and a lot of that comes down to financial independence. And a lot of what we do is empowering individuals as an individual, but also as a couple, to cohesively, look at their finances on either side to make sure that they feel individually empowered to be able to take control of their financial futures, whether it's within the career, within the family dynamic, but also within their own personal circumstances as well. And yeah, we're seeing a lot of that rise within the UAE specifically.
I think one of the most alarming statistics was around the 18 to 25 age group, and we hear this through our university partners as well. So 21% are saying that the pressure is unmanageable. And again, it's sort of challenging that statistic a little bit, because I would hate to think that it was completely true. But do you think there's also social media and expectations come into that as well? So when I was 18, 25, just wanted to make sure that I could afford my phone bill, but now it's, I want a Lamborghini, or I want to go to the Maldives every year because somebody I'm following is doing that. Is there an element of that as well, do you think?
Yeah, absolutely. I think we live in a 24-hour society, especially in the Middle East. We are in the Middle East and in the middle, and whether you're, working across different time zones, we are seeing, especially within my clients, I'm seeing the day-to-day working hours stem from starting earlier to working later. So there's definitely pressure on individuals. What I'm seeing is work-life balance tends to be a little bit better in terms of the time that they do have off. Here it is very much doing more frivolous activities and enjoyable activities, and again living in a country and in a society where we can benefit from the sunshine is fantastic on people's mental health and well-being. So from that point of view it's great, but in terms of working and the consolidation of the hours, the pressure is definitely there, but again the risk reward in terms of mental health, well-being, and also the financials is definitely, people feel they're here for maybe, an infinite amount of time, so they're trying to cram that into the employment or the workplace or the financial goals and achievements that they want to achieve. So there's definitely that, but I do think we live in this environment, and AI is fantastic, and actually it's quite interesting. A lot of what you're doing, I think, is the accountability of that, which blends into each of our pillars within the financial and various different pillars of well-being. And accountability from our side is definitely something that we're trying to engage with individuals and couples more so on, but definitely I think social media has a lot to play, and technology has a lot to play, and interestingly you say about wearables, because I sometimes wear an Apple iWatch and a Whoop band, so and data is great, but sometimes it's the role of all of us is to filter out the most appropriate data for each individual and for our clients, right? And I think sometimes when you leave the data to yourself in your own hands, sometimes it can be used to the advantage, but also not so, and that stems back to the younger generation. They don't have the tools and they're not equipped to be able to filter that data out themselves, so it can be very overwhelming.
It's kind of the two sides of the coin, isn't it? That question that you asked me at the beginning of, do you think that greater awareness of mental health is resulting in more people putting their hand up and saying that, yes, I'm stressed, and the other side of it, which is more awareness of everything, life through social media, is equally creating this enormous pressure on people to be something different, look something different, go somewhere different, or have a better score, or whatever that may be. It's sort of two sides of the coin, where it can be positive and perhaps create its own stress.
Absolutely. And there was some interesting demographic splits with male and female. So there's a question for both of you. I'll start with you, Leah. What were your observations that really struck you around the difference between the way that men and women deal with stress or report stress?
Yeah, and my team will know this, because when we got the results a couple of weeks ago, there was all this, but women aren't doing this, or women are struggling with this, and women are struggling with that. And I'm like, no. I'm like, no, we're not positioning this as women are struggling with, right? What is sitting beneath the data? So the way I sort of rationalize it in my mind is, we've got the difference of women. We've got women in the workplace who report generally lower scores of satisfaction with the workplace, probably because of their multiple hats that they're wearing from a family structure, societal perspective. And then you've got the flip side of that, and we saw it actually last year as well, that women who are not working are then having concerns and lacking that financial independence, and they're experiencing the loneliness and the lack of engagement. So they are also faced with a set of challenges, and they're worried about financials because, quite frankly, maybe they're not feeling in control of it, right? Or they're not able to contribute. So for me, and this is just absolutely my point of view, I've sort of split it into those two buckets, that you've got women that need more support in the workplace in terms of flexibility, understanding, support. And then you've got women who are not working, and we know that that's a fairly large part of the demographic here, in part because perhaps there aren't enough flexible roles in the workplace. They have a different set of stressors. Husband's always on his phone, everything. I'm that one in my house, by the way, so it's okay. It's not a male-female thing, but the people that are working are always working. And then there's the other things that are going on with kids and family and parents and healthcare and and everything else. So I think we've got two parallel trends running which need two different responses.
Thank you. Ezra, what are your observations?
Yeah, I agree there. We can see that, women are reporting, above the national average in stress and that level of dissatisfaction. There's something called the double shift, where women do their working day and then go home and start all over again. And we talk a lot about the mental load that is very unseen, that we, if you opened up our minds, what's going on all the time. So absolutely, those stressors are there. And I think it's a really interesting one. There's so much to unpack here because, like you say, we're looking for, or women are needing more flexibility. And you mentioned loneliness there as well, which I think is so important. If we could spend some time looking at that. We define loneliness as maybe that gap between the relationships that we have and the ones that we wish we had. So it's not about social isolation. It's about that feeling disconnected or feeling that our relationships aren't deep or that we don't have that, real depth of relationship there. And it's very interesting that has come out as being quite elevated. So I think when we're looking at what do we need to do as employers, and it's very different depending on who it is, whose well-being we're really trying to improve. And just to touch on, the Gen Z, I think Gen Z have really redefined what they're maybe willing to accept in the workplace. There's certainly older conventions that they are looking for more meaning, more sense of belonging, and that's great. I think I'm a Gen X, and I think we've got their well-being from last year was the lowest in workplace satisfaction, and is that attitudinal as well, that you're accepting these things, whereas younger people are able to look around and see that there's other opportunities out there.
It's really key, definitely. So I'm just wondering, from a King's perspective, do you feel supported nationally with policy in order to scale and build that trust, in order to deliver practical support for people to manage this stress and well-being?
I think we're fortunate that we live in a global hub here in Dubai, and it's a very hyper-personalised experience. If I compared, I've only been in UAE now 1 year, 1 day, so I'm still fresh. If I compare life before UAE to here, it's very different because you can. I still remember the second day my son wanted a football pump, of all things that came in 7 minutes. It's just you can completely dictate the lifestyle and choices that you want in a hub, which is a benefit to us, but it's also quite a challenge because that level of hyper-personalization means that people can radically value and experience life very differently to life in the Gold Coast. But if you think about, I think there's a question in there about UAE. I think when I made this decision, I had the choice of multiple other global hubs just because of the work I do in transforming health systems. It's a subspecialty. There's not a lot of us that do it at scale. And some of the things, I was writing this down because I thought about the statistic about why is UAE one of the most optimistic markets. And there's actually a fair few factors in this. And it reminded me of some work that I did in Australia about this idea of innovation hubs. And I'll nerd out on this a little bit, but just a minute, because I studied for a year, what actually makes innovation ecosystems tick. And the reason I did it was because I chaired a district in Gold Coast that was specifically curated, 200 acres of land for innovation. And it was a greenfield site. So I was like, how do we actually make this work? But just this statistic, some of the things that make sense for me in UAE is because we have access to some of the smartest minds in the world. Our human capital access is leading the world. And it's likely that UK's tax system and the European tax systems are impacting individuals that they want to come and work in a space. Well, let's face it, it's tax-free, and there's also financial capital here. And what we're seeing now, particularly in Dubai, and Abu Dhabi is such an investment in R&D. But R&D that is that triple helix model, which is we will invest in R&D if you've got government support, if you've got industry involved, and if you've got a local research institution. So, I mean, these are some of the factors that I can see that are emerging. We've also got a huge entrepreneurial ecosystem, probably many of the people in this room. And we've got this institutional framework that is led by the government that basically dictates that we are here to lead. I've never heard the word world or lead so many times in my life than in the 1 year in UAE. I feel like every person I speak to is leading the world somewhere in something that they're doing, right? You know, it could be like waste management or anything. And that to me is kind of rippling down to probably what's backing this statistic, which is culture. Like we have this culture to innovate, to, you know, in Australia you had this this tall poppy syndrome, which is like if you speak out too much. I actually think it's probably something we inherited from the UK. No offense. But,
Wrong room to say that.
Yeah, exactly. You know, Australians will cut you down, like, you know, bring you back to earth a little bit. But in UAE, it's like, oh, you want to be what? Let's do more for you. You know, let's make sure. So you know, if I really think about it, you know, and why I made this choice, because a lot of those elements were visible to me in the 1 week I spent here. And I think we're very fortunate. There was a question there about UAE that we have all this, and you can really, you know, so this is one space, and it's a moment of time, right? It may not last forever, but you can really build quite a life here that I don't think you can do in many other global hubs, to be honest. And again, going back to King's and our staff, we've got to acknowledge the ecosystem that we live in, the hyper-personalization, and make sure that the idea of how do we combat, you know, mental health and vitality for our staff is very difficult because it's so personalised.
Absolutely, thank you. Danielle, in terms of going back to the financial side, how can employers support their employees better with kind of budgeting or even just having sort of signposting if they find themselves in a bit of trouble?
Yeah, I actually think there's a huge opportunity here for employers. We're doing a lot of work with employers around financial well-being. I know a lot of HR departments within a lot of corporates are working on kind of the well-being pillars, and financial well-being definitely becomes one of that. But there is this huge opportunity, and I think, you know, going back to the shift in the gender gap with women, we're seeing that, and I think there's a huge risk for men as well with, you know, this movement from employment towards entrepreneurship and losing, you know, decent people from the workplace because they are wanting the flexibility. But on the flip side of that, what a lot of people value and why a lot of us thrive in the Middle East is community. And again, going back to employers, I think if you can get it right, and if you can really focus on, you know, empowering your employees to feel more financially stable, have more financial education and understanding within their resilience of the benefits, if you can provide the medical benefits, the various different benefits, and the flexibility alongside that, the community within the workplace can really add that additional value for individuals and employees as well. So, you know, the statistics around people who may look for another job, etc. I think, again, it's one of the biggest risks to employers, but it's also one of the biggest opportunities. And I definitely think, you know, if you can get that right by empowering and educating your employees, it's definitely something, and definitely a unique opportunity that people can have and employers can have. And in turn, that will increase productivity within the workplace. So, you know, that's the ultimate goal for employers. But I think specifically for employees, there's definitely a kind of foundation that you can get through the workplace that we can put in place.
It feels like the pendulum's swinging a little bit back, though, towards it being a very candidate-rich market, and there's so many CVs out there. Yeah. And, you know, to your point, Sandeep, about people coming here for the tax-free environment. So do you think there's also a danger as well that somebody that might be in a toxic working environment might just suddenly think, I'm just so glad I'm being paid every month?
Yeah, I definitely do. And when I sit down in front of my clients, obviously the financials come into play. We do the cash flow forecasting. Obviously, so salaries play a huge part, and obviously your income and your earnings. But I am seeing a shift towards this family dynamic, and people are compromising with themselves, but with their family as well, to what they value, and whether that's the salary, the employee benefits, the flexibility, the time spent on and off in terms of working and being away from the home, but also being nearer to the family, and definitely having that dynamic. So yeah, the financials is a pillar, and it's absolutely something that we focus on. But when you start to delve into the finer detail, when you're in front of a client and you're talking about their goals, their aspiration, and their future plans, the wider circumstance and all the different pillars 100% come into play on all plays. Yeah.
Thank you. Are you seeing that with your client base as well? Are they utilising their plans more around stress management?
So post-COVID, which always seems to be this benchmark, right? This pivotal point in all of our lives. The sort of post-COVID period, we have seen the utilization of mental benefits or mental health benefits quadruple, right? The people going and seeking care, seeking support. And we've also seen an increase in importance associated with mental health benefits in the benefits plan, so people asking for more. Also, that's sort of going a little bit broader. We've got more and more clients looking for support for autism and sort of a broader spectrum of sort of mental health support. Conversely, though, from an employee assistance program perspective, which is typically the sort of digital engagement with a counsellor or a psychologist, which we have embedded in all of our healthcare policies for the longest time, we're still not really seeing that needle move. I mean, I'm looking at Paul Firth over there, who's the expert, so I'm not going to attempt to be. Yeah, well, yes, you need a good one. That's absolutely right. But if I think about 20 years ago, Paul, the benchmark in the UK was still only sort of 3-4% utilization. That hasn't really moved here 20 years later. When you have got a good one and it's really, really well promoted, you might hope to double that. But there is still a huge opportunity in terms of awareness and having employers encourage this. I know certainly I've got my HR director here, Hannah, where we work with employees in specific situations and encourage them to engage with our EAP, it's always incredibly positive. So I think it's that first step of encouraging people, letting them know it's a safe environment, in breaking any of those, those sort of like psychological barriers of making that first step. So yes, we're definitely talking about it lots and lots more, both as an organization ourselves and with our clients. The demand for face-to-face, and I'm sure you're probably seeing the same, Ezra, right? But the demand for face-to-face probably outstrips the benefits available in healthcare, in the majority of healthcare plans, and that's a simple economics piece. But people, I still think there's an opportunity to try and encourage the sort of use of technology to get more people, preventive support and earlier support in the process.
Thank you.
Just to add to that, yeah, I totally agree, and I think what we're seeing is there's much more uptake on what I would describe as universal awareness raising programs. So for example, like mental health first aid, where everyone goes and everyone talks about mental health. How is that translating into an individual level? I think it's not as clear. So absolutely it increases maybe how comfortable we feel talking about mental health in general. That's very different from saying, I need actually some help now, I'm struggling. So I think that's maybe where you're seeing that there is that gap there. And I think another thing that we notice in just from a clinic perspective is that there's sometimes an expectation that these things will have a limited time. You know, how many sessions will this take? And it's an interesting one because it takes time. Things take time, and we don't ask the same questions about, well, you know, how many gym sessions and then I'm fit and then I'll just stop going to the gym, or, you know, you don't just stop going to the dentist, for example. So this is ongoing, and I think that's where I would, you know, really like to see that things moving and attitudinal change that way, is that we're starting to just say, oh, this is part of your, like we said today, this is your well-being, this is the overall picture here. It's not something that's time limited, and that we should be doing, you know, secretly without sharing it.
And when we talk about personalisation as well, so through the clinic, and I'm not asking you to kind of solve us all for our mental health, but are there, say, the top 3 things that you could share that focusing on them on a daily or weekly basis does improve?
Get my magic wand.
Yeah, exactly. I'll just take some notes.
I mean, with the survey is, you know, it's touched on, it's brought up so many important points, like loneliness. So the biggest single predictor of happiness and human, you know, well-being is relationships, positive relationships. And it's a Harvard study. It's the longest longitudinal study of adult well-being. It's been repeated. And, you know, so knowing and seeking out relationships and working in relationships that make you feel good. When do you feel at your best? Who are you with when you feel at your best? And when do you feel depleted? Sleep, it's really boring just to talk about sleep, but again, the survey highlighted that stress, if we're stressed, we're not sleeping as well. If we're not sleeping as well, we get stressed because we're not sleeping as well. So it's a cycle, and we saw there was the statistics about physical and mental health, you know, the decline there. Of course, they're interconnected as well, absolutely, and family come out of the survey as well, so family time, part of connection. Yeah, and again, I think we do need to learn from the Gen Z, you know, attitude sometimes of what we're saying. We're protecting our peace, and maybe we are putting in place those boundaries and recognising when we're coping well. Not all stress is bad, like you said, but also recognising ourselves when we do need to take that step back.
Yeah, so kind of like signs for burnout before you get to that burnout.
Absolutely.
Can I just jump in there, because it's quite interesting as well, because, you know, 10 years ago you would sit down in front of a client and you'd look at your finances and you'd say, okay, you're saving towards retirement, and if you need an emergency fund, it's because the boiler broke, or it was these tangible emergencies that we might see with our material assets. Now, you know, you're looking at essential expenditure and luxury expenditure, and the luxury expenditures used to be the gym and various different, you know, sabbatical or holidays or whatever. But the lines are really blurred now, because it blends into your mental health, and for some people the gym is a pillar of supporting their mental health, or, you know, a massage on a Sunday is what they build into their, you know, resilience in terms of their mental health. So it's not as simple as that, and you really need to look at yourself and your own circumstances and figure out what works for you, and various different other things. And again, you know, when you're looking at a cash flow of someone's life, you would targeting towards retirement. Big expenses used to be, you know, university or a child getting married, for example. But again, a lot of my clients now are factoring in a sabbatical, or they're factoring in, you know, this emergency fund is their get out of jail free time, you know, free card, and it allows them mentally to be able to cope with the workflow and the financial pressures of day-to-day life, knowing that they have this pot of money there to fall back on. And again, it's blending all of these areas together, and it's definitely developed, but I definitely think in the Middle East there's a huge opportunity for us all to be able to create this dynamic that works for us individually.
One thing that appeared to me in the study, that things that obviously the UAE is really outshining, makes me very proud to be living here, but then obviously that we've got to keep that up. So where do you see the opportunity for employers particularly to maintain those levels?
Yeah, thank you, Katie. Great question. So I think if we focus in on some of the themes that we've seen. We've seen this gender disparity, and I think exactly as you're saying, Danielle, and I think you said the same as well, Sandeep, you know, no one size fits all, right? We have to understand that between individuals, but also by gender as well. There may be more pressures. So I think that really focusing in on what is important in your workplace, and going asking people, right? Like I said, these things don't need to cost a lot of money. In fact, when Hannah came in last year, I'm going to put you on the spot here. She came in last year and we were talking about various different things, and Hannah ran a brainstorming session with lots of sticky notes and a board. And I think some of the folks were in there for sort of an hour or so, and they said it was the most therapeutic thing that they've done in a long time, was just getting it out there, talking about it, and then realizing that, yeah, I feel the same, or I think the same. So I really think that understanding, and that's helped us drive a very specific agenda in our workplace based on what the needs are of our teams, right? So I think looking at, you know, personalized to your situation, your workplace, considering what gender needs may be, and it may or may not be, right? These are massive generalizations. I think if we think about the positive things, if family is so important, let's make sure that we reinforce that, and create the space for people. And I think we can't deny, if you like, the financial piece. I think it's you know, in the UK we talk about the weather, and in the UAE we talk about the cost of living, right? They're the sort of, you know, the two common topics.
And the traffic.
Sorry?
And the traffic.
Oh, and the traffic, yeah. Well, don't get me started on the traffic. Come on. But I think, you know, I don't think that that's something that's going to go away. As you say, there is definitely a situation where perhaps salaries, dare I say it out aloud, are sort of, you know, shifting the other way at exactly the same time that cost of living is showing absolutely no give in it. And I think that is creating a lot of stress, because especially when you're here, Danielle, and you're probably supporting families back home, you want to know that you've got that safety net. You know, the different visas and things like that really help some people in society create a little bit of flex, but not for everybody. So I think that financial piece and that financial well-being and helping people have a plan, right? Whatever that plan is, just having a plan sort of takes it off your mind in the middle of the night.
Thank you. I think we'll close on that concept of planning, because I think that covers every single pillar, and it gives us all something to kind of think about. You've been amazing. Thank you so much for sharing the study and for sharing, you know, delving into it from your different expertise. Thanks for your participation and engagement as well. Thank you, Cigna Healthcare.
Thank you, Katie.